Hello, my friends. I am really excited for today's guest, Anna Kooiman. And Anna, I want you to just say hi really quickly. This is recorded for my podcast, of course, but also, Anna.
Yeah, so I love that we are just collaborating today, Dr. Bree from Lady Bits, and I love the name of your podcast, by the way, as well. We seem like we're on a similar mission, and so I'm just thrilled that you're having me on, and that I can share your expertise as a women's health physical therapist with my followers as well. I've got my 6-week-old nursing at the moment, and yeah, we'll be talking all things pelvic floor and tummy muscles and returning to exercise in a safe and effective fashion. So thank you again for having me on.
You're welcome. I am so excited that actually one of our followers who follows you and follows me introduced us. Really, that's kind of how we connected at first. And since then, I've just been like, loving over all of the work that you're doing. I think it's amazing. And partially because I was really looking for somebody who really focused and specialized in fun fitness for the prenatal and postpartum population, because I definitely have an expertise in that area. That's what I do with pelvic floor physical therapy. But I also have a more, I'd say, a more broad scope where I'm really looking at all age ranges and also some other types of specific issues like prolapse and pelvic pain, things like that. But I love, Anna, that you really specialize in this period of life, the prenatal and postpartum period. And I love that you're doing it all in real time and showing your followers exactly what you are doing as you recover and, will have your babies, first of all, and then recover and get back into fitness. So it's
Well, that's the idea. I mean, I think so often, you see trainers and they come back 4 months or 6 months after they've had the baby and they look amazing again. And who knows how they got there. Sometimes you can look amazing on the outside and on the inside. I'm sure you talk about this on your program. You can really be struggling right on the inside with pelvic floor weakness or even ab separation or a combination of the two. Got my 2-year-old who wants me to wash his hands, so I'm gonna have to get off the boob. But that means our followers will get to see this little girl.
Oh,
Sorry, talking about in real time. It's like if we didn't do it like this, it wouldn't get done.
yeah,
My
exactly.
has a work dinner tonight, so or not a work dinner, a work meeting. He should probably be back in the next little bit. But I'll keep talking while I've got Brooksy, and that's okay. So the idea with Strong Sexy Mamas is that we are really trying to help women get their pre-baby body back or close to it. That's everybody's goal, but at the same time, who really wants a pre-baby anything? Because these are the best gifts in the whole world, even when you're 2-year-olds. Wash hands. So this is Brooksy, and he is now 2.5. And before Brooks was born, I was a marathon runner. I was a triathlete. I ran, big marathons, Boston, New York. We did triathlons and all kinds of things. And I did slow down when I was pregnant with him, but I got real serious about my recovery. I did get really serious about my recovery because I learned a bit about ab separation. And I did have some myself, not a ridiculous amount, but a good amount. I just had 2.5 fingers, and I did get it close pretty well. But the integrity of it was not fantastic. I did have some pelvic floor weakness, nothing that was out of the ordinary, I wouldn't say, to anybody else. But it made me just think from all the research that I did, and then I started getting back into fitness. I used to be a fitness instructor before working at Fox News Channel as the Fox and Friends weekend co-host. That was my job in New York. And so I was in fitness and I got back into it and started doing lots of prenatal and postnatal education and realized that there seems to be a real disconnect between the fitness industry and what you do, Dr. Bree. It's like there's this group and then there's that group, and the fitness group seems to go balls to the walls and go crazy like fire immediately from the beginning. And then I find, no offense, not you actually, you try to make it fun too, But then the physical therapy community, it's so boring. And I have to do this for 10 repetitions and da, 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 and who wants to do it?
Exactly.
So
That's
I,
why I do what I do. And that's what got me. I was so glad to get out of the clinic because when I was in the clinic working with patients, I would want to be doing some hip circles and making the moves fun and kind of coordinating routines. But that just doesn't work in a treatment setting where there's, people doing their shoulder exercises and their ankle exercises in the main, workout area. So
well, that's why you have such a big following. I mean, that's why you've explained, and I hope Strong Sexy Mamas does the same. My business is relatively new, but yeah, I think we've really hit something, and I'm glad we're sort of joining forces.
for sure, for sure. Making pelvic floor fitness, pelvic floor friendly fitness fun and mainstream because I'm with you. I feel like the more mainstream fitness programs, they're not thinking about the pelvic floor. Most mainstream
Yeah,
fitness programs that I've experienced are not mentioning it. They're not mentioning much about form that's going to help protect your pelvic floor and your abs if you have that separation, things like
yeah.
that. So,
Yeah, gosh, it's like, you want to, for me, my goal was, it was to get my body back and get my abs back or whatever. That's sort of what everybody's excited about. But it was more about just feeling like myself again. Because I'll tell you, at about 16 weeks, so, not even maybe 14 or not even 4 months postpartum, everybody was like, you look exactly the same. Like, oh my God. But I hadn't even gone for a single run yet. I didn't feel like it. And then when I did start going for runs, it didn't feel right. And I think there's a lot of things that people don't talk about, not even just with pelvic floor weakness, but just the aches and pains, the pelvic pain, the lower back pain. Our posture is so out of whack after we've gone through the biggest change of our lives with pregnancy. Um, and so just trying to get back in alignment is what I try to do on Strong Sexy Mama. So the way that my workouts go, and I'm not sure when this podcast will air, but we do have a 6-week challenge coming up. Like I said, I'm 6 weeks postpartum, and this will start when I'm 7 weeks postpartum. But we will have multiple challenges coming up along the way anyway, fitness and nutrition. Um, but I really try to get everybody in alignment, do all of these things, set the foundations to begin with. And then after we've done that, we will be doing 2 different types of exercise classes. One is to the beat of the music, and that is Coiman cardio is what I call it. It's basically all my favorite fitness classes that I used to take in New York City when I was hosting television there. And it's sort of the pointy edge of the spear. I feel like New York and LA for fitness.
yeah.
So all my sort of favorite fitness formats blended into one. So it's dancing, kickboxing, athletic drills, a bit of toning, but it's all to the beat of the music. So it's super fun, kind of like a Zumba class or something, but a little bit more of a mixture. And it's all pelvic floor friendly, or at least I give options. So when I'm jumping, I'll show, an option not to jump. Or if I'm doing something that's going to put pressure on the linea alba, the fascia on the midline of the belly, then I'll show, a modification for women to do. So it's not necessarily that every single move is pelvic floor friendly, quote unquote, but I show modifications. And, as a new mom, I already noticed my pelvic floor this time is so much better than with my son. And part of that was the way that she was born and the way he was born. But I think it's also the training, the diaphragmatic breathing, the transverse abdominis activations, and of course, the pelvic floor function that I've been really working on. So we try to do a lot of that in Strong Sexy Mamas and get women to feeling good, because that's the most important thing. I mean, your confidence, right, is the thing. I'm sure you would agree.
Yes.
Your confidence, the way that you feel on the inside really shows on the outside, doesn't it?
Absolutely. Absolutely. Yes. And I wanted to actually talk about this. Our theme today for this conversation is really small steps to get you running and jumping again. And so, what would you say? I mean, with all of this, with getting that confidence back, because a lot of us do find our confidence in our fitness. Not everybody. Some people are not, not really into fitness, but for those of us who are, I know I was. That was my confidence. That was my happy place. That's how I felt my best. And it's really what drove me was getting back into running. Now I'm actually not a runner anymore. I had some issues of my own and it's all good. Everything's resolved, everything's good. But for anyone who does want to get back into more high level, higher impact fitness, how do you help your mamas with that? And how do you help keep realistic expectations so that they don't think that they are going to be there, 6 weeks on the dot after having their baby?
Yeah. Well, I remember my OBGYN with Brooke said to me, it takes 9 months to make a baby. It's going to take at least 9 months to get it back. And one of my best friends is a GP here in Sydney, Australia. And she told me the same thing. She said, it's going to take you at least a year. And I said, you don't know me. I am type A and I am so fit. And you don't know about all these marathons I used to run.
Yeah.
All that. Like I said, I think in a lot of ways I looked similar to the way that I was, but I didn't. I felt like I had to be very ginger with myself, and I think part of the reason for that is nursing, and I think that's another thing people don't talk about. The hormones that we have when we are breastfeeding our babies. They're a lot of the same hormones that we have while we're pregnant, and some of that keeps our joints and ligaments lax. And of course, it's a natural thing. It was, if you believe in God, God created us to be able to birth babies and to, have this relaxing hormone that made our bellies be able to expand. But unfortunately, it made some other areas of our body more lax too. So we're more prone to injuries, right? We're more prone to whether it's hip or back or, that type of pain, pelvic pain, or even knee injuries. I mean, all of it. So we do have to be sensitive during this time. And even more, if you are breastfeeding, we have to remember that those hormones are still present. So it really is small steps that you have to take, and you do need to be realistic. And I guess I have found an appreciation for slower paced exercise than I had before. I was all about the boot camp and the plyometrics, and I still love that because that gives me the endorphins rush. But I found a nice happy place with exercise as well, just doing Pilates style exercises, probably similar to what you do on your YouTube
Yeah.
channel.
Well, I've always said that I feel like actually the stronger you are when it comes to especially core fitness, the more you're going to feel the exercises, even if they're slow, even if you go back to a beginner workout, the stronger you are, the more you'll feel it. And actually the more you'll get out of it because you can actually, sense every single muscle and you can really know how to work it well when you have the time to go slow and go with control. It's slow and
100%.
controlled is better than fast and sloppy any day.
God, I totally agree with you. And I guess that's another reason why, because, well, I'll say that I do teach live classes here in Sydney, Australia, and I have taught a few in the US as well when I get to the opportunity to go home. But predominantly what I do is online fitness. And I would love to be at everyone's house and everyone's living room saying, okay, you need to have your hips square, and actually touching their hips and moving them the way that they're supposed to go. But you can't do that in online fitness. And with COVID-19 right now, I think we're going to be in an era where everybody's doing online fitness for a very long time. Yeah. And it's important that we are sticklers for our form, just like both of us are, in our workouts, because if you're doing something with poor form with little 4-pound weights, it's not good. But if you're doing something with poor form with 20-pound weights as a woman, because
really
you think
not
that's
good.
going to help you, then you're going to end up, pulling a disc or something in your back. So,
or experiencing prolapse, or exactly. So many
or
things
that
can go wrong for sure.
exactly.
Yeah.
Exactly.
So I'm curious. I know that one thing I strive to do with my instruction is to teach people how to really find these deep core muscles themselves and learn some basic kind of form tips so that they can then apply that to any workout they do. And I know that you do that too in your workouts. So what are some of the most important things that you tell your folks about so that they can really apply them in your workouts, but also just in their whatever other fitness classes or routines they want to do?
Well, because it is Strong Sexy Mamas, I mean, it's for all women, but predominantly it ends up being prenatal and postnatal women and then women with older kids. And I'll say one thing on social media, my older followers, they often say to me, I wish I had this information because now I'm struggling, when I'm 50 years old or 60 years old, not necessarily in their 30s and 40s, but, they didn't take care of themselves, whether it was, through fitness that they were doing too much, or it was just that they weren't doing their pelvic floor activations and looking after their core.
Mhm.
And so I do think it's very important. So we start at the very basics, and I try to, as hard as I can, not to make it boring, because they're the tiniest movements, but they're the mightiest movements. So we do pelvic floor activations to begin with very often, and a lot of times women are doing their pelvic floor exercises or Kegels or however you want to say them. They're doing them incorrectly. They're accidentally squeezing their butt cheeks, or they're squeezing their quads, and so I really try to give multiple visualizations for women to figure out where is my pelvic floor? Am I doing this right? So I'll say, close and lift both sphincters from the front and the back, or the front passage and the back passage, things that don't sound so great, or try to stop the wind in the rain. Or I'll say, when you're on the toilet, try to stop a stream of urine, but don't get in the habit of doing that, because you can cause bladder problems. But at least you'll know whether you're doing you're using the right muscles or not. Or imagine you have a diamond down below and you're trying to draw all 4 points together: your pubic bone, your coccyx bone, and your sits bones. I have a million different cues, but
Mhm.
I'll try to get them to activate their pelvic floor. We do deep diaphragmatic breathing. A lot of women, or a lot of people, I guess, don't even realize that the diaphragm is part of our core, right?
It's the
And
roof. The pelvic floor is the floor and the diaphragm is the roof. Exactly.
yeah, and they work hand in hand. And same with the transverse abdominis. Everybody's excited about this, trying to get a six pack, and that's our rectus abdominis, of course, which I'm sure you talk about. But what we really work on in Strong Sexy Mamas is getting people to activate their transverse abdominis, which is the corset muscles on the inside that wraps around, yeah, like a corset. So I'll say, imagine you have a string on either one of your hip bones, and you're trying to draw that string toward one another, pulling those hip bones toward one another as you bring your belly button just toward your spine and wrap those transverse abdominal muscles in. So I like to pair the transverse abdominis activation, so the corseting, with the pelvic floor activations, with the belly breathing, the diaphragmatic breathing, and something I call connective breathing. It seems like different trainers have different names for them,
Mhm.
but that's what I call it, and it seems to work well. I know some trainers like to try to incorporate that into every single exercise. For me, I did try that in a couple of my classes, and the women seem to not want it. It's too many things to think about. So what they've enjoyed is doing it at the beginning and doing it at the end. And the theory is that it becomes more autopilot anyway, and then it will just switch on during your actual workout. So my warm up and cool down always have that belly breathing, the connective breathing, the transverse abdominis activations, the pelvic floor activations. And then as far as trying to get back to high impact exercise, I think a lot of it is giving yourself enough time, not having unrealistic expectations. And then when you do go back, do small bits. And that means small bits with your lady bits. How about
Yep,
that?
I love it. So, oh, hey, we've got a new book title right there.
There we go. We're co-authors. Here we are. Small bits with your lady bits. So, whether, say you want to go for a run, well, you don't run initially, you're going to jog, and you don't jog on the pavement, you're going to jog on the grass or the beach, and you're not going to pick up your knees really high. You're just basically going to do a little tiny shuffle.
Yeah.
And maybe you do that twice a week, and then you move up to 3 times a week. And then you move up from, instead of just 3 or 5 minutes, you're up to 8 minutes.
Yeah.
Or exercises, if you do want to get back to plyometrics, like I told you, for me, plyometrics makes me tick. It makes me feel like $1 million, and I just want to do them again and again. And so, but you do have to be careful with that. So if you want to get to a box jump, for example, which is really popular with the CrossFit community, if you have CrossFit viewers, you would jump up, or instead of jumping up, you would just step up and step back down. And then you can start, doing half and half, where you might jump up, but then step down.
Mhm.
So it is small steps to get there, but it's so important, I think, to build a strong foundation for this house so it doesn't come tumbling down
Absolutely.
later.
Yeah, absolutely. You ask any contractor, any construction worker, I am not one, but they would say the same thing. And I mean, we need to treat our bodies like that. So I love that. I love that message and small steps to get you running and jumping again. It's not to say that even if you have prolapse or you have bladder leakage or you have some kind of concern during pregnancy or postpartum, it's not to say
Yeah,
that you won't be able to run and jump again. In many cases, you absolutely will, but you have to do it stepwise and with care, like you're talking about. So I
yeah,
love that idea of getting the core activation going and then doing those gradually progressive intervals to get back up into the runs. I usually encourage people to do maybe even like 15-second intervals and then walking. And maybe they do eight to 10 intervals of 15 seconds each, just short little jogs
yeah,
and walking in between. And if their internal compass says, okay, this worked for me, meaning that they didn't have any issues, they didn't have any bladder leakage, they didn't have any feeling of heaviness or any discomfort of any sort, then it's like, okay, cool, maybe we'll do that again, or maybe even do a little bit more. But if
yeah,
they had a sign or signal like leakage or heaviness, then it's like, okay, well, that's my signal. Not that all hope is lost, not that it's all over, I'm never going to be able to do that again, but that I need to either back down a little bit or, work at that level for quite a while longer before I can push it up a notch. So it really
yeah,
is just different for everybody and absolutely tuning into your specific needs. And I usually encourage people to go slower than they think they should, in air quotes. Like if you think you should be able to run a mile, that's probably too much. Do half of
yeah,
that or do those little intervals that I just talked about. And then if you're good, if all is good, if you proved yourself right that you're fine, then go ahead and push it up. But you really have to listen to your signals or you could be setting yourself up for real problems down the road.
yeah. One step forward, two steps back,
For
huh?
sure.